in the heart of Yorkshire.
Hello, Emergency Department.
An unbeatable team.
That way.
And stop, we're going to lay you down.
Hard at work 24 hours a day.
Does it count as a daily exercise?
7 days a week.
I can smell it now. It's a really bad burn.
Saving lives.
It might be that we need to put you to sleep in order to try and sort this out.
Helping loved ones.
It's a shocker, that.
Making the community they serve better.
We got you, lad.
You're being such a good boy.
A health service treating anyone.
Car door, house door.
Van door.
Big van door.
Yes.
So it's quite impressive, isn't it?
And everyone.
Oh, you're going to have a good black eye.
Are you, doctor?
A team doing anything and everything for each other.
It's just been mental down here. I will do it. I'll get to it.
We're strong people in Barnsley, you know.
This is Barnsley Casualty 24/7.
You're absolutely all diamonds. Brilliant.
We fixed him.
On shift tonight, advanced clinical practitioner Chantel,
Open your eyes. Wake up for me.
emergency nurse practitioner Darren,
I want you to show me once. Go on. Champion.
and registrar Dr. Chris Carson.
The only way I can describe it is it's going to feel like you're dying.
So, get ready to share a shift with the team at Barnsley Casualty. Barnsley Casualty is bursting at the seams. And covering resus today is advanced clinical practitioner Chantel, who's already 4 hours into her busy shift.
I started at midday, so I'm on till 10 o'clock tonight. So I'm restocking on energy for the next part of my shift. Right, I need some food.
Yeah, somebody brought these.
Black pepper.
What is that?
Yum yums and I.
Yummy, yum, yum. Oh, okay. There's a lot of sugar. Come on,
Why
stop.
one?
You've eaten the whole pack.
No! I need energy.
You will need insulin soon.
But her energy refill will have to wait. Another patient is on their way.
Pounds what you need. Right, what you got?
A man in his mid-30s
Yeah.
has had a suspected overdose.
That's fine. We'll see you in resource.
He's unconscious and his heart rate is dangerously low.
Is he breathing for himself?
Yeah, he
Yeah.
is. Respirate with us was 8. We think he's had diabetes, pregabalin, and esophagus.
Okay.
That's just what was reported to us. There was nothing unseen.
Who report?
A rehab care facility.
Okay, and then they found him in bed and then... Okay. I'll just have a quick listen to his heart and lungs while...
Let me try and wake him up.
His conscious level was low, he wasn't responsive, he wasn't alert, which can be quite normal in certain drugs that patients take. So we treat him as we'd treat any patient that were unconscious and start with their airway and work his way through.
So his sinus brady, chest sounds clear, cat refills 4. Not like he's injected anything.
Apparently not a IV user, just tablets.
When someone's taken an overdose, certain drugs can slow your heart rate down.
Has he responded to pain?
He's not responding to that at all. But I think it is going to be an ultrasound job.
It's really important to try and find out exactly what a patient's taken. Certain drugs can cause severe damage to organs.
Cannula.
What colour? Green?
The team need to test the patient's blood urgently.
It's just trying to get it before it starts to wrap around the artery.
Yeah.
But he's so dehydrated, they're struggling to find a vein.
Do you want me to have a go?
Have a gosh. So
Yeah.
that one went in it and it started bleeding back and then it just clotted.
He's really dry though, his cat refill was 4. Right, give me an adapter.
Eventually, advanced clinical practitioner Chantel is successful.
Got a bandage wearing there in case he knocks it. Thank you very much, then. Right, I'll prescribe some fluids and some more naloxone.
This patient being unconscious, one of the drugs that we have to take into consideration is, has this patient taken an opioid? What the ambulance crew gave is a drug called naloxone. It attaches to the opioid, it blocks it and reverses it and allows the effects to wear off quite quickly, and then the patient does wake up. So we thought we'd try that again.
I think if he has a bit of stimulation, his heart rate will go up and his breathing will go up. And some naloxone, my little love. Thank you. See if that helps him.
A low heart rate could mean he isn't getting enough oxygen to his organs.
Do you want it all in one go?
Yeah.
With no time to lose, Sister Claire administers the drug.
There's no immediate response, is there?
No.
The drug hasn't worked. The next hour is crucial. The patient's body could be failing him.
What I do like about resus is time can go quick, and you do get the most interesting things in resus.
And it looks like resus is going to be busy. A 58-year-old woman is being blue lighted in with a dangerously fast heart rate.
I want to see you in resus then. Bye.
Paramedics have tried to lower her heart rate, but unsuccessful, they're on their way in. Registrar Dr. Carson heads to resus to wait for the paramedics to arrive.
Hello.
Hello. Hello. Tracy. Yeah, pop her up there.
Tracy's heart has reached around 200 beats per minute. The team need to slow it down, and quickly.
As we see, dude.
Thank you.
Paramedic Lee hands over.
So Tracy's been at work today. About 10 o'clock, she started with palpitations and sort of chest tightness around underneath her butt, going into her back.
Yep.
We've arrived, noticed that she had SVT. Never had SVT in her life.
Yep.
No other past medical history.
Fine.
So heart rate 193, SATs 96, BP 141/121.
How are you feeling at the minute, Tracy?
Still feel as though it's throbbing.
Yeah. A quick listen to your chest here. Get down. Come on, quick feel of your wrist here, Tracy. If her heart continues beating as fast as it is, and her blood pressure continues to drop, it could actually lead to a cardiac arrest. Any chest pains at the minute?
It's just taking, pulling my boston round my back.
Okay.
Dr. Carson and the team need to act quickly. Advanced clinical practitioner Chantel is only halfway through a very busy shift in resus. She's treating a patient who's overdosed.
Let's wake him up.
His heart rate is dangerously low and he's struggling to breathe.
Wake up for me. Open your eyes. Hello.
Always works.
We shout at the patient to try and see how awake they were. We use a scale called the Glasgow Coma Scale. We measure eye opening, the patient speaking to us and how they're moving. So we go through a few processes and it gives us a score of how alert that patient is.
Wake up for me. Wake up. Have a look around. Where are you?
Nearly went to localise, didn't I?
Yeah.
Oh. Hello, sweetheart.
Same words.
Have you got any more words?
Is withdrawing and localising.
When a patient's not ventilating properly, we need to figure out what part of the ventilation process isn't working properly. With this patient, he was gurgling. That could be a snoring noise or what we call a stridor. It's when his conscious level is quite low and he's not protecting his airway anymore.
Concerned he's rapidly deteriorating, advanced clinical practitioner Chantel calls for backup.
Not all his bloods are back yet, so let's see who's covering critical care today. Hi, it's Chantal, one of the ACPs in Resource. Is it OK to refer a patient for a critical care review? Perfect. So he's currently in a rehab facility for drug use, and the rehab assistants found him in bed with a GCS of 3 and then rang an ambulance. The assistants have found some diazepam, azopiclone and pregabalin with him. We've gave him another shot of naloxone, again with no response. He's just not ventilating really efficiently. Thank you.
Worried about the patient's oxygen levels, advanced clinical practitioner Chantal gives him support.
Right, so we've just put a face mask on this patient because his oxygen levels are a little bit low in his blood. So critical care are going to come down to see him because he's not breathing properly. So we'll see what they say first. Hello, so we don't know what he's taken. He normally takes pregabalin, zapiclone and diazepam anyway, but there's no evidence of what he's actually taken.
The critical care doctor checks the patient over. In a serious condition, he may have to be rushed to intensive care. Today, the beds in Resus have been filling up fast. Another patient that's being urgently treated is 58-year-old Tracy, whose heart is beating 3 times faster than normal. Dr. Carson is treating her.
So Tracy, we're going to get you hooked up to all of our monitoring, all right? Yeah. It looks as though your heart's beating really fast, something we call SVT, just means it's beating really fast. We're going to try and slow it down.
SVT is effectively a kind of malfunction of the electrical circuit in the heart, which tells your heart to beat much faster than it should be doing.
Am I good to go? Blood pressure's just cycling. It's whenever your heart's going that fast, it struggles to pick it up. Yeah. What were you meant to be doing today?
Working.
You were working, oh.
And then going to caravan at 4:30.
Oh no, for bank holiday. Where's the caravan?
Ingermouth.
Where's that?
Skegness.
Oh, right, okay, yeah. It is skeggy.
When patients come into Resus, I think it's really important to try and put them at ease. Although they're quite unwell, it is a scary place to be.
What time are you meant to set off?
4:30.
All right, so we're on the clock then. Well,
With no time to lose, Dr. Carson starts the procedure.
oh, and there we go. We got the blood pressure as well, the magic of the curtain. Right, so you're going to blow on that for about 20 seconds, all right? Let me see if I can see a clock. And then, as soon as you finish that, we're going to lay you down pretty flat, and I'm going to lift your legs up in the air, all right? Yeah. Not the most dignified thing you're ever going to go through, but there's no one else around. All right? And hopefully this will fix it.
The point of this is to try and slow her heart rate down by stimulating a nerve which runs through her neck. And in some cases, by stimulating the nerve, the heart rate returns to normal.
And go. Keep going, harder as you can. Well done. Keep going, that's 10 seconds. Keep going. Okay, 5, 4, 3, 2, 1, and stop. We're going to lay you down. Give it a few seconds here, all right?
Does it count as a daily exercise?
All right, we'll pop the legs down then. That hasn't worked, I'm afraid.
Dr. Carson needs to try a different technique.
It's a drug called adenosine. It effectively slows your heart down. The only way I can describe it, it's going to feel like you're dying for a few seconds. You're not, okay? We're all going to be around. We're going to keep a really close eye on you.
Adenosine effectively stops your heart very briefly and resets it. It's almost like turning a socket off at the wall and turning it back on to restart a computer.
All right, we're ready to go. So, like we say, you're going to feel a bit rubbish, all right? Just breathe through it. We're here, okay? We've got you. So in a few seconds, you're going to feel that, okay? Yeah, well, the rate's coming down. So it's gone back up again. I'm gonna have to do it again, I'm afraid. So this time we do it double the dose.
There's a chance Tracy will go into cardiac arrest if they can't get her heart rate down. Resus isn't the only department under strain today. In minors, emergency nurse practitioner Darren has a long list of patients waiting to be seen.
So just log on, see what's on, and then we've got clinic, so some clinic patients to see.
The EMP role is vital because every patient that we can take away from the main department means that they've got more capacity to deal with heart attacks and strokes, etc.
No flyers in there, I'm afraid. The hotel's in. Some wax. Feels like I'm on a boat, what you see, you know what I mean? Yeah. Can I just check your other ear? Just in case it's flown out way through. I can't say there's not between them.
The humour is an extremely important part of my job. If you didn't have a sense of humour, you would go under, for definite. Who wants to see a miserable nurse practitioner? I've heard that before. I've heard that happen before, so.
It's usually hearing aids and cotton buds that's stuck in people's ears. But I have pulled out flies before. But not today.
Which is good. I originally didn't want to be a nurse. I'm a sort of reluctant nurse. I was a maintenance engineer. A bit of an accident that, for me, it was life-changing. Took a year out. I got young kids, 1-year-old and 2-year-old, so I like house husband for a year.
Can you lift your legs straight up for me?
Okay. And then bend your knee as far as you can for me. Excellent. I needed something to do after that. I didn't want to go back into engineering, and my wife suggested bank auxiliary nursing.
The good news is I can't see the ulcers. So, next thing, we'll just put a yellow dye and see if we've got any abnormalities on that.
I said I'll give it a go, but if I don't like it, I'm coming home after half an hour.
Just blink a few times, somewhere. Right, it is showing a very small ulcer there. It is tiny, but it does need treatment.
Within half an hour, I knew this was what I wanted to do. It was an epiphany, and I loved it right from the first day.
Yeah, good news. No bones broken. Treat it like a sprain. Yeah. Ice pack it. Don't strap it up. Keep doing what you're doing, walking on it.
I started at the very bottom and I've sort of worked up through the ranks over time. I've had a taste of everything and I've liked everything I've tasted.
I want you to show me your guns. Yeah, go on. Come on. Champion. Not wrong with them. Right.
My philosophy is get them in, get them out as quickly as possible. It is a one-stop shop for the nurse practitioner service.
I think it's probably muscle part of your bicep. Yeah. But we'll do an X-ray just to make sure you're not pulling any bits of bone off. Just in there. Okay.
As emergency nurse practitioner Darren makes his way through endless patients, he's not the only one with his hands full. In Resus, so has advanced clinical practitioner Chantel.
It's a busy shift for me.
She's monitoring a critically ill patient who's OD'd. It's 5:23.
I had such a lovely morning at home as well.
And she won't clock off until 10 p.m.
Our next patient is.
Another suspected drug overdose is on the way.
We're just going into there.
What's his story?
He was going to the Drug and Rehabilitation Centre. Staff there were concerned that he's stumbling about, not at his normal self, and he's taken something. He then had an unresponsive episode, so they've given him 400 naloxone, which has just made him agitated, thrashing himself about the floor.
I think we're having an overdose day today.
They said it's like...
Advanced clinical practitioner Chantel needs to assess how responsive he is.
Open your eyes. Wake up. It's GCS is fine.
He was only released from prison. He's not had his methadone since then. His drug test on that day said that he'd had cocaine as well. That's all we really know about him.
Okay.
When we've got a patient that's quite agitated and aggressive, I can handle it fine. The only thing that can get quite scary is that when you're trying to cannulate a patient or you're trying to take some blood tests from them, it's quite a dangerous thing. If you get stabbed with a needle as well, you don't know if they've got any bloodborne viruses or anything like that that could transmit onto you.
Back in the hub, Dr. Jake Winterbottom has met the patient before.
The guy in T I saw on Saturday night.
Yeah, so he's aggressive and thrashes.
Yeah, once you've given him naloxone.
Ah.
So
Practically beating him up on Saturday.
200 makes him a bit thrashy, 400 makes him very thrashy.
When someone comes in with a repeated overdose, it can be quite frustrating because there is emergencies and that takes us away from them patients. However, we have to treat everyone the same, everyone fairly, and they can turn to a life and death situation.
Not wanting to put themselves in unnecessary danger, the team will keep a close eye on him
Open your eyes.
Oh my word.
and hope he regains consciousness.
So I've got a feeling he's going to fall off that bed.
It's all going resus today. 58-year-old Tracy wants to leave there to go to her caravan, but her heart is beating dangerously fast. Dr. Carson has attempted to lower her heart rate with medication.
Good to go, yep. Right, let's see what happens. No, not doing anything, is it? No. Right, one more go.
Can't feel
You're not feeling anything?
No.
I've never seen anyone not feel anything.
I have no idea why it didn't have an effect on her, as almost every patient I've seen who has this drug will tell me they feel like they're dying, and they hate it.
Dr. Carson can only try this drug one more time.
Right. Number 3.
If it doesn't work, he will need to escalate to more extreme measures.
So you ready? We'll go on 3. 1, 2, 3. So all in. There we go. Arm up. Yeah, we'll stop there, Haley. And done the job, I'm afraid.
Tracy's becoming a bit more worried about the situation, and quite rightly so, because the drugs that we've given her haven't worked. If we don't slow her heart down, it could lead to a cardiac arrest, and Tracy could die.
Today, resus is unusually busy. In Bay 5 is 58-year-old Tracy. She has a dangerously fast heart rate. Dr. Carson has tried to slow it down with medication.
And done the job, I'm afraid.
No.
No, so we're going to have to give you another drug. Oh, she might not be getting to the caravan today.
Yeah, maybe.
What's going on there? Hey, if you stay right there, don't move. It's looking good.
Eventually, Tracy's heart rate starts to drop.
Told you, fear. It's fear of not making it to the caravan. Yes, it's coming down now. If that heart rate stays as low as it is, we should be able to let you go home later.
Oh,
And then what we'll do is we'll bring you back as an outpatient. How long are you in the caravan for? Is it till Monday or Tuesday or something, is it? Or
Monday.
Monday, fine. Brilliant. If anything changes, or if you start to feel really unwell, just grab Haley or any of us and we'll sort you out, all right?
Yeah, excellent.
Do you need a drink or anything?
I'd love a drink of water, please.
Drink of water? No worries.
Tracy will continue to be monitored.
There you are. No problem.
If her heart rate does increase again, she'll need to stay in hospital. It's been a gruelling shift for advanced clinical practitioner Chantal. She's juggling the care of not one, but 2 overdose patients.
I just hate it when I've not finished one job and then something else happens, which I suppose that is A&E, but I'll get back on top of it.
You can get sometimes pulled from pillar to post, but you've got to just try and stay relaxed and calm. But it's sometimes near impossible. I don't know why I'm even trying to justify it. It's a nightmare sometimes.
Oh, another 4 hours to go. I think I need more coffee. No, I don't need more coffee.
Her second overdose patient is no stranger to Barnsley Casualty and has been in resus already this week.
I feel like I can't concentrate at writing because I can hear him thrashing about.
Can't move the bed while you're hanging off the end.
You have to be mindful that patients do repeatedly come in, and sometimes you don't really do anything, you just observe and they do wake up, but you can't presume that they're going to wake up because there could be something else going off.
Open your eyes.
Sister Claire is monitoring him closely.
I think he'll just come round and be aggressive and just walk off. He's done it before, hasn't he? We can't take bloods off him because we'll end up getting injured and stabbed with a needle. And his obs are fine and his ETG is okay.
Yeah.
The first overdose patient can't be moved from resus until he's been assessed by consultant Dr. Dave Walker.
He's now opened his eyes to voice. I mean, he was GCS 3 when he arrived 2 or 3 hours ago. I'm with him now. He's now GCS 14. He's still sleepy, but he's got no head injury, so he's on the mend, but he's still very sleepy. Cheers then. All right, thanks. Bye.
You can go.
You can go.
Lovely.
The man can now go to the acute medical unit where he'll be monitored.
Hey up.
Oh, that's such a voice.
What's your birthday? What's
Yes,
your birthday? Lovely, thank you.
He's getting better, isn't he?
Yeah. Not quite as screechy.
You've got like a piercing mum voice.
Oh, yeah. It works though.
Yeah, he's getting better. That's loads better than earlier.
Yeah. Taking you up to the ward, lovey, all right?
Back in the hub, advanced clinical practitioner Chantal needs a pick-me-up.
Have you tried dark chocolate?
Oh, good.
Okay.
As there's still 2 hours left of her busy shift.
Oh. Try that little bit there.
Wow. That's quite. Oh. I've tasted some stuff in my life that's horrific. I feel hot and bothered and that stuff that's sick. That's what it is. Try this.
Oh, go on, Chris.
Chris, don't.
If you're a dark chocolate lover, it's nice.
This is dark.
That's disgusting.
Oh, what is it though?
Is it like that's not dark?
Asim brought it in.
Over in Miners, they're swamped with walk-in patients. And emergency nurse practitioner Darren is trying to get it back on track.
Is it, John?
It is, Julia.
His next patient is 87-year-old John, who's come in with a large tear to his skin after falling out of bed.
I must have been asleep. The trouble is I've got 2 pillows, and normally I've only got one. But I must have slipped and I've just gone all over. I've hit that on side cabinet like.
Elderly people's skin bruises and tears very easily through the age and possibly the medication that they've been on. Even catching on a door frame can cause some quite large and horrendous looking skin tears. Okie dokie. Right, let's get that cleaned up and
patched up then, haven't we?
Yeah.
So I'm going to give that a bit of a clean, get that skin to come across over there. It's going to sting.
Yeah.
So I'm just going to try and unravel it all.
Such an intricate procedure requires delicate hands from emergency nurse practitioner Darren.
Sorry, John.
Right.
Just about there, I think. That should do it.
Yeah.
So I'll get district nurse to come out in a couple of days
Right, yeah.
and change your dressings.
Yeah, right, fair enough.
Who's that you've come with, John?
My daughter.
Right, you're a sergeant. Right, come on then, we'll go back to your daughter.
Right. Thanks, mate.
No worries. I'll get district nurse to come out on Tuesday, if that's all right.
You phone me, because normally they turn up without me knowing.
Right, I'll tell them to phone you before they come.
Yeah.
I've seen things never expected to see or to deal with. Funny, great, tragic, sad, but all a privilege to be involved with.
Over in Resus, which is still very busy, 58-year-old Tracy is being monitored after her heart rate returned back to normal.
A lot better. I haven't got the palpitations now. I'm aiming to get out so I can put a caravan. Yeah. Love you all. Bye. I'm hoping to get to my caravan in Ingermills. We go every Friday. I don't think I'll be going back to work. Not today, anyway.
Dr. Carson has been in charge of her care.
What have you done? Did it work with the adenosine?
Yeah, she had a adenosine, but she didn't feel a thing. Like, even after the 18, she was just sat there.
Did she not feel like she was dying?
No. There was a point where I was thinking, is the cannula in? And then she just reverted.
Dr. Carson goes to check on Tracy.
Feeling all right?
Yeah.
It's good. It's good heart rate.
But you won't recommend going back to work today?
I'd probably take today off, yeah. I think that's all right. Just avoid things like, really caffeinated drinks and things like that. So, strong coffees.
Is lager okay?
The odd one's all right, yes. I wouldn't begrudge you a drink on a bank holiday weekend.
Okay.
Right, I'll leave you to it. Half an hour. Hopefully get you home. All right.
Thank you.
Tracy left Casualty and had a successful caravan weekend away.
Thank you very much.
She hasn't had any other heart problems since. And that might be one patient out. But paramedics have brought another one in.
Yeah, let's get you sorted.
51-year-old Paul has severe asthma and is struggling to breathe.
Frank, you back or you warming up? You warming up.
Sister Jane takes the handover.
Paul suffers with asthma and has been hospitalised numerous times and intensive care once. This morning he had an episode of chest pain, just continuing to feel worse.
With what? Shortness of breath?
Shortness of breath, yeah.
Advanced clinical practitioner Chantel comes out of Resus to help.
Hi, Paul. My name's Chantel. Are you allergic to anything?
Just an antibiotic.
Just an antibiotic. Which one?
I have no idea.
You don't know which one?
We have most antibiotics.
With most antibiotics.
It was for a reptile bite, so...
It was for a reptile bite?
Yeah.
What reptiles?
23-foot Burmese python.
Is that what you've got, pythons?
Had.
You had pythons? And what, since you got bit, you no longer have pythons?
No. Asthma kicked off too much. Yeah, I had over 600 pairs of snakes.
600 pairs of snakes? Where did you keep them all?
Converted house.
You converted your house for snakes? Oh, gosh. You've clearly got a love for snakes, then. So do you have nothing now?
We have a Grand Salmon pink bird eater. Tarantula.
You've got a tarantula. To be fair, I don't mind a snake. It's the spiders. And we'll do your bloods as well. What's happened?
So last week I had 2 days that were bad.
Yeah.
And then yesterday with my GPs,
Yeah.
she ever wanted me to go to hospital or start steroids.
Okay.
So I started steroids.
Have you felt more breathless?
Been very tight.
Quite tight on your chest?
Yeah, straight down middle.
Yeah.
Short at sides.
Any pain or just tightness?
I don't know, chest pains.
You've had some chest pains?
But I've had angina.
So you've got angina as well? And when did you get diagnosed with angina?
5, 6 years ago.
And have you had a cough, a worsening cough recently?
I've been coughing since November.
Have you been coughing any blood up?
I did last time I was in hospital.
What do you take for your asthma then?
Symbicort, Benylin, and a new one, I can't think what I call it.
Spiriva?
That's the one.
Okay. Are you using your inhalers more?
Probably close to 60 puffs of it.
60 puffs today, and it's not improved?
No.
Just wanted to make sure that from a breathing point of view he were comfortable and he were ventilating properly before I proceeded to find out what was going off with him.
Just listen to your heart first, so just breathe normal, okay? Take a nice big breath in and out. And sit forward for me. Big breath in. If you feel a bit dizzy, let me know. Great stuff.
Whilst Paul has his assessment, his wife of 20 years, Fiona, arrives.
Are you okay standing up? Just because I want you to open your chest so we get an accurate reading. And I don't need to tell you how to do it because I bet you're an expert.
Next, the amount of air Paul can breathe out of his lungs is tested.
Good stuff.
The dangers of severe asthma is that a patient can't get enough oxygen into the lungs properly. The airways are quite inflamed, they constrict, they tighten, they can't move mucus as easily and they can't get air in as easily. It can be a life and death situation.
It's fine, you can take your seat. Good stuff, 600. That's impressive. Okay, are you all right? Is that all right?
Damaged my lungs back in 91 with a chemical paint stripper.
Paint stripper. What did you do?
Inhaled it. It was actually a banned paint stripper. I've passed out quite a few days.
Okay.
Came round in the army hospital.
Okay. And then what happened?
Then I was medically discharged from the RAF due to breathing difficulties, which I've never had.
So do you think your asthma's all started from that?
Oh, definitely.
It made more sense when he told me about the inhalation of the banned gases, so it's probably a chronic condition going off.
But advanced clinical practitioner Chantel still doesn't know what has triggered his breathing difficulties. She sends Paul to radiology to check if he has a serious infection, or even worse, a blood clot.
Oh, Jaffa cake. Always got the Jaffa cake.
It's nearly the end of advanced clinical practitioner Chantel's 10-hour shift.
I'm glad that I'm out of resus now, because it was driving me crazy.
But she still has a patient in cubicle 3.
So his x-ray's back now.
51-year-old Paul came into Casualty short of breath.
The lungs are clear, the heart looks fine. There's no evidence of any pneumonia. It kind of corresponds with what I was listening to on his chest anyway, so I'll go tell him his good news. So, all your blood tests are normal, which is good, and your chest x-ray is normal, it's lovely and clear. So there's nothing to actively treat. One of the really reassuring things is, you know, that breath test you did, it was really good. You had a good volume. So you're taking in a good volume and you're expiring a good volume. I'd continue the steroids that the GP put you on yesterday, so finish that course. Have you got an appointment to go back to see them? Make an appointment though. So sorry I can't fix you. But at least that we know there's nothing acute going on, you've not got a pneumonia or something like that. Is that okay?
We get a lot of patients coming in with chronic conditions that we just can't fix. Our job is to know what that condition is, treat and manage that and refer on accordingly, but we can't fix and manage the chronic problem.
Right, let's get that needle out then. And then we can, you can get home to your tarantula. How do you cope with this tarantula? Is it one tarantula you've got?
Just one now, yeah.
Do you like it?
I like it, but I'm highly allergic to the hair, so I can't touch it.
What if it escaped?
Then I would be in the house.
You'd be off.
Paul came back into hospital the following week, and after further investigation, they found he had an infection on his right lung. He's now on the mend. Advanced clinical practitioner Chantel isn't the only one who's had a chaotic shift today. Charge nurse Johnny is making his way through a busy paediatrics.
Time you on till, Johnny?
Yes, love. His next patient is 11-year-old Finley. His mum Jade and brother Noah have brought him into Casualty.
Did you see it happen, Noah?
No, I was with Ben.
You was with Ben, right.
After Finley hurt his head after school.
Finley, will you come this way, mate? Let's have a look at you. Are you mum?
Yes, yeah.
What's happened, Finley?
So I was leaning forward on my chair and the chair's come backwards because it's not stable and I've cracked my head on the table.
Okay. You're not being sick, have you? And you're not being knocked out or anything? You had nothing coming from your nose or your ears or anything? No fluid or anything? No. I'll just check your eyes are working. Keep looking at my nose a second. Good lad. Perfect. So we've started to do like a nurse-led discharge now for head injuries. So are you happy if I just clean it, stir it up and glue it, and then...
When I saw it, I did kind of say, well, just pop a plaster on that. They said, no, it looks a tad deep, so I didn't know what was the best
No, that's
idea.
fine. Yeah, it'll need a bit of treatment on it.
Okay,
but it's up to you. You can wait. I think it's about a 4-hour wait now to see a doctor. Or I can stir it up and glue it now and you can get off.
You can super glue it if it's a 4-hour
Yeah.
wait. Yeah.
Mum, I want to be a doctor. I don't want to see.
You don't want to see what?
That.
You don't want to see blood?
Yeah.
Oh.
Maybe not the profession for you then, mate, if I'm honest.
Back to the drawing board on that one. How brave he is, Noah. Not a bother. Good boy, Finn. There seemed to be a flappy bit of flesh before. I know that's probably not the technical term, but that's what I'm going to go with. So I just kind of left it.
So what we'll do is, because it's a bit bigger of a laceration, we'll use some steri strips first to like pull the wound together.
Yeah.
And then I'll glue over the top of it.
All fixed up, Finley has one happy mum.
Thank you.
It's all right.
That's brilliant, isn't it?
Thank you.
Try and keep that wound nice and dry for about 4 or 5 days, okay?
Okay.
If the steri strips start to lift off, you can just trim them down.
Right.
Okay. And there's just a few things to look out for.
Right.
Anything unusual, anything you're worried about, always just bring them straight back.
Yeah. Thank
Yeah,
you so
you
much.
get yourself
You've
off.
been brilliant. It's been
You're
so
welcome.
efficient. Thank you.
Finley was a great kid. He just sat there and let me do it, so it'd be nice if every patient did that.
Yes. Off for ice cream and hot chocolate.
Yeah.
It's time for advanced clinical practitioner Chantel to clock off.
Nearly there. I'm not at work tomorrow either. Might have a pamper day.
But she wants to check on one final patient before she heads home.
All right.
Yeah, I'm alright. I need to come.
Yeah, that's fine. You can go if you want. What did you take?
Freedom.
You took some pregabalin.
Yeah.
How many did you take?
Yo, wasn't in my pockets.
I didn't check your pockets. You were a bit aggressive, but
Whoa.
a bit, yeah.
Can't remember.
You need to be careful taking them.
I know.
You came in on Saturday like this as well, didn't you?
Yeah.
That's twice in a week.
I used to taking them.
Well, you shouldn't be taking them if you're not used to taking them. 3 times in a week. I'm off. Right. See you later.
With her last patient discharged, it's the end of another demanding shift for advanced clinical practitioner Chantel.
To work in A&E, you kind of want that pressure. You want to be in that environment. I think if I worked anywhere else, I'd be quite bored. But sometimes you cannot wait to get your hair down and run out.
But her colleagues are beginning their new shift, ready to face whatever comes their way.
If you or someone you know has been affected by any of the issues raised in tonight's programme, please go to channel5.com/helplines for information and support. With Tristan away, Skeldale House is busier than ever. The new series of All Creatures Great and Small begins tomorrow at 9. Next tonight, 999 Critical Condition.